Hi, I'm Lloyd, and I have cystic fibrosis, more commonly known as CF. And I have people from time to time that ask me, well, what is CF and what is it like to live with CF? Cystic fibrosis is a genetic lung disease. You can't catch it. It's terminal. The average life expectancy has grown to about 40 years old right now. And essentially, it has to do with every cell in a cystic fibrosis person's body that does not function properly. Normal people have water that lines around their cells and basically whisks away bacteria and other things. But a cystic fibrosis person's lungs especially don't work that way. Nothing whisks the bacteria away because that water that typically should be there is not. And so anything bacteria, germs, bugs nest there, and it's almost like a garden that's fertile. It just grows so much better in a cystic fibrosis person's lungs. And so we get sick all the time. In fact, I've heard the expression that if you have asthma, it's like breathing through a straw, and if you have cystic fibrosis, it's like breathing through one of those little red coffee stirrer straws, which I can't even imagine that. But then again, I don't know what it's like to breathe normally anymore. I'm pretty old with this disease. What's it like to actually live? Well, I'll tell you, every morning I get up and I do machines, put on my vest like this. It's a vest that thumps me and knocks that junky mucus off. And I do a nebulizer with the same shot, look like this. And I do that for half an hour, 45 minutes every morning and every night. And I just want you to imagine what it's like. I mean, I'm 47. Imagine what it's like when you have a 2-year-old that you have to do this with, because you have to do this to help keep your lungs clear. After I get done with my vest there, I take a ton of pills. This is the story of my life. All sorts of medications that I have to take. I average about 40 pills a day. I've figured out in my lifetime I've taken almost 500,000 pills. And that's just to keep me healthy. When I get sick, I have to do antibiotic pills. And if I get sicker, I have to go into the hospital and do IV antibiotics to kill the infections in my lungs to help everything go right. I take medications like this to help me eat as well, because cystic fibrosis junks up your digestive system. So for a person to stay healthy, an adult, they have to eat 4,000 to 5,000 calories a day, if you can believe it. And I'm skinny, just to say skinny. And then the other thing that's really important is exercise. I'm going to show you my little get up. I have a backpack with an oxygen tank. When I was little, I didn't need oxygen necessarily, but now that I'm older, my lungs aren't as good. I throw on some oxygen and I go run. And exercise is incredibly important for a lot of people. It's a life or death thing for cystic fibrosis patients. They've got to work their lungs to stay alive. Now, I would tell you this. You don't get to be 47 years old with CF without help. I definitely think I've had divine intervention. I have an amazing support network in my family. The CF doctors, the clinic that we have, is like family to us and all their support. And then there's people or foundations like the Cody Dearth Benefit Foundation, which help cystic fibrosis families because it's incredibly expensive. I mean, I'm standing actually, I have a whole stack of medical bills when I get done with this video that I got to go through. We spend tens of thousands of dollars every year out of pocket, even with insurance. And so the Cody Dearth Benefit Foundation helps with things like that. They help with doctor's appointments. They help with money for gas to doctor's appointments. They help with exercise equipment. There's all sorts of things that they jump in and help with. And so this year, as you think about the end of the year wrapping up, would you please consider giving to such an amazing foundation? It helps old people like me, and it helps young families who are battling with cystic fibrosis to take financial burden off of them. So thank you.